You're on Focus with Brandon Bonedorfer, and today we are in Neillsville, Wisconsin. Marshfield Clinic of Marshfield, Wisconsin announced in a letter of intent to acquire the Neillsville Memorial Medical Center earlier this week. We came to Neillsville to meet with staff and leadership here to discuss the acquisition and see what's in store.
I'm Chief Executive Officer at Memorial Medical Center. We're a rural critical access hospital, 25 beds that's fully encompassing from trauma all the way to outpatient. We service mainly Clark County with both emergent and elective care. Probably our main focus is primary care.
Now, this hospital has been in the Clark County area since when?
The first hospital was in the early 30s. Facility opened up in 1954, so we just turned 60 a little while ago.
In a recent press release issued by the Marshfield Clinic, they announced in a letter of intent to purchase Memorial Medical Center. How did that come about?
Since the beginning of the project, our intent was to work with Marshfield Clinic on providing specialty services like they have. We've been partners with Marshfield Clinic for over 30 years. Not partners, informal partners. We work with patients that travel back and forth between the two organizations every day. In late December, we started to talk more serious about what that arrangement would look like for specialty care. And from there, both sides, both organizations, identified the positive opportunity we could if we worked closer together.
What are some of those positive opportunities that you mentioned?
Well, for our patients, 85% of Memorial Medical Center patients also are patients at Marshfield Clinic. If we're under one ownership, we can bring Marshfield Clinic specialists here easier, or their resources here easier, so patients don't have to travel as much.
So it really improves the amount of access that they have to health care. Is there any areas of specialty that will be increased or brought into the Neillsville location?
Well, what's exciting about this is all the specialties become available to us once this is final. Instantaneously, we want to start looking at cataract surgeries coming back. We will focus on oncology and try to get into chemotherapy, expanding our orthopedic coverage, more cardiac services online. Everything is up for grabs right now for us to start implementing, as long as we have the space and the staff to do it correctly.
What does this acquisition mean for those patients that are already a member or patient of both facilities?
I think it puts, by combining electronic medical records, eventually it gives easier access to the physicians that treat that one patient from both sides, immediate access to all the records instead of faxing and sending items back and forth. So much easier sharing of medical record information for that patient to make easier transition of care between the two facilities. So the notes become immediately available for the primary care physician that probably sent that patient from here over to Marshfield Clinic to see a specialist.
In addition, when you look at insurance products, some insurances they take that we don't, and vice versa. Now, if you have an insurance product and you couldn't get it here, but you had to go to Marshfield, now you'll be able to get it here. We approached Marshfield Clinic around securing specialty healthcare in our new facility. Knowing that we were partners for many years on several programs, it quickly I realized, and we both did, how much we really have in common with providing quality care in our community. I have to applaud Marshfield Clinic for stepping up and giving us an opportunity to become part of the Marshfield Clinic Health System and open up this community and this organization to opportunities, resources, programs that we never thought we could get, that we're going to be able to now bring them to Neillsville in the new facility. Being owned by Marshfield Clinic, the real advantage is when you have two organizations that are working that are under two umbrellas, any type of sharing of resources have to have a contract or an agreement behind it for it to be really legit. In healthcare, we want as many services as we can here, especially in emergent situations. And as one, resources can flow back and forth very easily. So if we need an orthopedic surgeon this afternoon and they have one available, he can come over and do a surgery. So the efficiency of becoming one made so much more sense than trying to remain separate and try to figure out how to do that kind of proactively. This just is going to be very seamless.
When we look at combining the facilities under one umbrella, we have critical access hospital rural health clinic standpoint here that allows us cost reimbursement. When you combine two organizations, it allows us to get the cost reimbursement on some of the patients or the costs that Marshfield Clinic was not. So it brings federal money into our program to help care for the patients we can care for locally. It's money that the federal government pays to keep rural health care in place.
What is rural health care?
Rural healthcare is a special status that hospitals and clinics can get when they're far or a certain distance from other facilities. So rural health status gets us special reimbursements to ensure we can keep healthcare local in rural communities.
Merging with the Marshfield Clinic, this is going to provide you more federal funding?
We should be able to get more federal funding to provide more care locally. When we look at rural and bringing these extra dollars into our community, it helps us expand the care we can provide. We can look at clinics in other outreach areas to put as we expand the services we provide here.
And have you guys developed or looked at any niche areas that need expansion of rural health care?
We're just starting to come together to ensure we can continue to provide what we already are today in a new state-of-the-art facility, basically replacing one that has been here for so many years that needs replacement. And then we'll build on that with new programs as we identify what we can service locally. And the cataracts is one example of that, of just starting to expand service lines.
If you look at all Clark County, there could be more healthcare everywhere. In a lot of areas where we've invested, like Loyal or Greenwood, in a clinic, it may not be full-time, you may not have lab, you may not have x-ray. We know the closer you live to a healthcare facility, the healthier you'll be. So we'll look at the county and say, hey, that's a good spot where we could hit a couple thousand people. Here's a good spot. And then how do we provide service there to meet the need?
How do these changes impact the employees?
I think it's job stability for both locations. We both facilities have lots of openings, and you have lots of recruitment needs in healthcare these days with the shortage of nursing and physicians. This just strengthens the ability to recruit to a larger system and more opportunities as we grow together.
Predominantly from Memorial Medical Center, we now can enter into a growth mode. With the additional specialist resources, access to people coming here to practice medicine, we can get busy every day. And with that growth, our employees feel, I think, a lot more secure.
As employees of the Marshfield Clinic, will they have access to the same benefits that the Marshfield Clinic employees already receive?
Yes. So when we transition over, we'll be transitioning over the benefit package as well to be Marshfield Clinic.
I understand there's a target date of June 30th that you're looking to begin this acquisition. We're looking at the 1st of March here, early March. What steps have to take place between now and that letter of intent date of June 30th?
So I think Ryan's been explaining it well. We just got engaged and we're working towards that marriage date, and there's different due diligence items that we go through ensuring contracts can continue on after you convert over. And so it's really just doing our homework to make sure when we go live we have everything set up to do it successfully. What
kind of questions is the community asking?
Are we going to continue to treat people as well as we do? For some reason, I think there's been a concern that the bigger you get, the less intimate you get with your patients. Like, we know a lot of our patients by name, and we get to know them. And I think in this rural community, that feels good when you're in need. And so a lot of it is to stay close to your mission, and are you going to change the way who you are? And we've been safeguarding to them the whole time, saying, no, that's no matter what name we have on our badge, we're still going to treat people the way we feel is right.
What are you excited for in a new hospital? What does that mean for the community? If it is MMC or it is Marshfield Clinic, what does this hospital mean for rural health care?
I think a new facility offers that new platform to provide care the way it's moving today. There's a lot more provided on an outpatient basis, where a lot more, when this hospital was built, it was inpatient. You stayed the night for most things. So as we've added onto this campus, it's become confusing to transition through it. And then we also have a facility it's aged and it's time to replace it. So the new building gives us a new platform to deliver better health care.
We're excited. We're a very innovative organization. So technology is our focus on a lot of our design. So telehealth, e-consults, intervention. When we look at like an EICU, all those things now become viable as we really bring modern healthcare into a rural community. From the very beginning, in making this decision, our mission is to provide the very best quality of care, one patient at a time in this community. We clearly saw as this relationship matured with Marshfield Clinic that we could fulfill our mission so much better as one than separate.
Well, that was great. We got to talk to the staff here at the clinic and talk about what's going to take place between now and June 30th as the Marshfield Clinic and Neillsville Memorial Center become one as they unite under the name Marshfield Clinic. I'm Brandon Bondorfer, and you're on Focus.